so that I know that I don't go over. So thank you for having me here to talk today. I'm going to talk about, it maybe seems a little bit removed from the world of guidelines, but what I focus on is giving patients access to their own health information and how this seemingly simple change, particularly in the area of clinical notes, can help to facilitate some of the discussions and conversations that need to happen in order for patients to really engage in their care. So the idea of a fully transparent medical record and allowing patients to have access to things like their clinical notes comes out of, I think, two broader movements that are happening, sort of larger shifts in our culture. And the first is this growing conversation and concern about who owns our data, what they do with it, and who they share it with. And this conversation is intensifying as we learn more about how the data that we share online, sometimes knowingly, sometimes not, is used. And who should have control of how that data is used? And patients in healthcare are really no exception. We're seeing this sort of growing movement among patients that this is my information, I need it, and I'm not waiting for it, so you need to give it to me. And then second, there's this growing shift, this idea that we need to move care away from tertiary centers and out into the community. So there's a person here on this slide, Sarah Regare, who manages her own Parkinson's disease. She sees a clinician for about 1 hour per year and then manages her disease herself. She spends about 6,700 hours in self-management per year. And she's very good at documenting it, so if you're interested, I suggest that you look her up. She's pretty fascinating. But in order for this kind of a shift to happen away from tertiary centers and out into the communities where people are, people need information. And why shouldn't that information come from their own clinical record? So I'm going to talk today about open notes, which is an example of one of the ways in which clinicians can share this kind of information with patients. So what is open notes? I'm going to start by first telling you what open notes is not. It's not a software. We're not a software company. We're not an electronic health record vendor. We don't code apps. We don't have a server full of notes somewhere that we mine for information. We're a philanthropically funded initiative that is focused solely on the idea of transparency in healthcare and encouraging all clinicians to share the clinical notes with their patients. We began as a pilot in 2010. This idea was piloted in 3 organizations. We had about 100 primary care clinicians and 20,000 of their patients. And they just turned the switch on. They shared the notes. And we evaluated it to see what would happen. This note-sharing idea, based on the strength of the evaluation, has started to spread across the United States. Starting with about 20,000 patients, we now have over 27 million patients who have access to their own clinical notes at more than 200 healthcare organizations. And we're generally focused on physical health, but we see note sharing is starting to move slowly into areas like mental health. So we evaluated the pilot, and I'm going to spend a few minutes with you just sharing what we found. So we surveyed the patients pre and post implementation of this intervention. And what we found when we surveyed them post-intervention was that majorities of patients, more than 3/4, said that reading their notes helped them to take better care of themselves. It helped them to remember the care plan. It helped them to feel like they could make the most of their visits, to feel in control of their care and take an active role, and prepare for office visits. It has particularly positive effects on medication adherence. So 2/3 of patients said that after they read the note, they understood why the medication was prescribed. They felt in control of their medications. More than half said that reading the note answered questions that they had about the medications. They understood the side effects. About 1/3 said they read the note and then they went and looked for more information. And 14% said reading their note made it more likely that they were taking their medication as prescribed. And one of the surprises from all of the research that we've done is one of our initial hypotheses was that this intervention would be really helpful for college-educated, upper-income, sort of well-resourced patients. And what we find is that these findings, these positive findings, hold across demographic groups with disadvantaged, traditionally underserved or disadvantaged populations reporting actually more positive benefits from reading their notes. So that was a big surprise to us. We also surveyed our clinicians. So these are primary care clinicians in 3 organizations. And we spend a lot of time traveling around the country talking to healthcare organizations about open notes and why they might want to share their notes with their patients. And we hear sort of the same worries from clinicians. They worry about time spent in documentation. They worry about more time before and after office visits as patients call them, email them, are confused about what they're reading. They worried a lot about requests to change the notes. So not because of an error, but because the patient just didn't like, my patient's not going to like what I write, and they're going to ask me to change it. So that comes up regularly. They felt that they worried that notes would increase their patient's anxiety or worry, or that they'd be offended. They also felt like this was just one more thing that they were being asked to do, and that it would have low value for their patients. And what we found in our evaluation, and has been replicated across many other organizations, is that these things generally don't come to pass. Patients are pretty resourceful. When they don't understand something in the note, they find someone that they can ask. They go to Google. They're looking anyway. Some organizations have looked at their email and phone volume before and after and found no change, have surveyed patients and found that for every patient who said, yes, I was confused and I called about something in my note, there were about 1.5, I don't like to call them half patients, but that's sort of what the data says, who didn't call. They read the note, they were no longer confused about what they had to do, and they didn't call. So we see that this kind of intervention has very small effects on clinician workflow. So what does this have to do with guidelines? I know that's what we're here to talk about today. So what does this have to do with guidelines? And I have two words, but both have been talked about before. I'm going to talk about them some more: patient engagement and shared decision-making. So when patients, we know from the literature that when patients are engaged in their care, they have better outcomes. So we see this across different disease groups. They report higher quality of life scores. They're more satisfied with their care, and they're more likely to get appropriate, cost-effective care when they're engaged. Shared decision-making, which is a more sort of prescribed way to have conversations with patients when there are care decisions to be made. Patients who engage in shared decision-making say that they also show increased satisfaction. There's reduced conflict between the clinician and the patient about what should happen. They report greater trust in their providers, which we know has downstream benefits on outcomes. And they report better self-management and adherence to treatment for complex chronic conditions. So shared decision-making has these benefits for both outcomes and for decision-making. But what do patients need? So there was some discussion a few minutes ago about what clinicians need, but what do patients need? What kind of competencies do patients need to develop in order to really engage in shared decision-making. They need time, they need information, and they need trust in their clinicians. So I'll take each of these in turn. Information. We know that patients remember about half of what they're told in an office visit. This gets back to something that Gregor was saying earlier about the conversations that patients